Here, October is National Breast Cancer Awareness Month. According to the CDC, breast cancer, the second leading cause of cancer death among women in the U.S. It accounts for about 30% of all new female cancers each year. So we want to talk about treatment, prevention to keep you safe. We have medical oncologist and assistant professor of medicine at UC San Diego Health, Dr. Angelique Richardson. Doctor, thank you for being with us today.
Thank you for having me.
Of course, this is so important to talk about because we know prevention is key to all of this. But let's talk about the treatment options. What's happening now? There's been so much research over the years. Where are we now with treatment?
Yeah, we have had a lot of advances in the treatment of breast cancer. And thankfully, because of the advancements, we are seeing people live longer and we're seeing more people cured after being diagnosed. So we have chemotherapy, we have immunotherapies, and different endocrine therapy options that are available.
Okay, so different therapy options.
Yes.
Helping keep people alive,
yes.
right? I mean, they might be hard to hear that you might have breast cancer, but it's no longer this death sentence, right?
Yes, that's correct.
Okay. Tell us about the, obviously, checking and all of the prevention measures, how important that is.
That's very important because if we catch breast cancer in earlier stages, then it's a higher chance of us being able to cure you.
Okay.
So prevention and also early detection are both very important.
Okay. As far as early detection goes, what are the rules now? How early do we need to get those mammograms? How often should women be checking, or men?
Yeah, so we recommend checking at least once a month as far as you knowing what your breasts look and feel like. So we teach really breast awareness.
Okay.
And that's just knowing, as I mentioned, what your breasts normally look and feel like. But as far as getting mammograms, you should start getting mammograms every year, starting at age 40. And that's for average risk women.
Okay, but if it's in your family, say your mother had breast cancer, you need to do it sooner?
Yes, for those patients, we say you need to talk to your doctor because you'll need to screen sooner.
Okay, and obviously the mammograms are so important. Also knowing your breast density, can we talk about that?
Yes.
Dense breast tissue, that's an important one to be aware of.
It is, it's very important, and it's so important that now it's mandated to have that information on your mammogram reports.
Okay.
So make sure that you look for that information, but you also discuss that with your doctor, because sometimes that means you may have to have screening more often, or you may have to have what we call supplemental screening. And that can include an ultrasound or MRI, but you really have to have that discussion with your provider.
Okay, so if they say, make sure you ask, first of all, if you have this, but also they can take other measures to check. It doesn't mean that they can't see things.
Exactly.
Okay, let's talk about the demographics. I know we report on this a lot. There are demographics that unfortunately are more at risk. Can you tell us why that is and who this affects?
Yeah, that is unfortunate. We do know that, for example, in the African American or Black community, although the incidence or the risk of having breast cancer is a little bit lower, the chances of dying from breast cancer is about 40% higher after diagnosis. 40% higher. Yeah, so that is really significant. And there are many reasons for that, but one of the reasons is late detection.
Okay.
So again, it's important to know your risk and to get those screenings.
Okay, so that early detection is really important. Get those mammograms, know your own breast tissue, what it feels like. If there's any changes, of course, see your doctor. We do want to talk about the Pink Walk, wearing pink today to represent, and it's happening November 3rd. So tell us about the walk. How can people get involved? We still have some time, right, to sign up?
Yes, you still have time. I plan on being there.
Nice.
It's a great event. We're closing down the 163 this year for this walk. And so please come out. People come out with their friends, their family. It's a great way to get involved. Yeah,
and we're looking at some video here. Closing the 163, that's when you know it's a big deal. We want a lot of people to be part of this, taking over the streets. Of course, it's to raise awareness.
Yes.
Why is that so important that we keep talking about this and we obviously do these walks and get involved?
Yeah, it's so important because we want to make sure that people aren't afraid of the word of breast cancer. And that they avoid getting screenings or they talk to their friends and family about treatments after they've been diagnosed. So it's so important to raise awareness, to know if you feel something in your breast, please get it checked out.
Okay, please get it checked out. Dr. Richardson, I know you focus on this line of work. I'm curious what brought you into that? What drew you to this type of medicine?
Yeah, what drew me to this type of medicine is that, like many of my patients that I see, unfortunately, our family was touched by this diagnosis as well. And so from that experience, that led me to wanting to see what can I do to help impact other people who are impacted by this disease.
Right. Helping them and
Helping
hopefully
them, yes.
treating them in time.
Yes,
Oh,
exactly.
Thank you for the work you do, Doctor.
Thank you.
Appreciate it. Appreciate your message, and hopefully people at home are taking away an important lesson here today.